What are, in your opinion, some of the most important questions or conversations patients should be having with their healthcare provider?
Establishing early on what a patient's and their the how they share this with their physician, what their goals of care are, right? Some patients will tell me that their only focus is their quality of life, right? That they want to receive treatments that pose relatively little risk of making them sick. Other patients will say, I don't care about the risks with any of these therapies. I will do anything that might extend my life by a day or a week. And so having a shared vision for where you're going together as a team, I think is really important right from the outset. And that can evolve, right? Some patients initially want very aggressive therapy and later want less aggressive therapy. But I think if you don't have an agreement on that from the outset, things are bound to go wrong somewhere. Um, and then I think establishing trust early on between physician and patient, that sounds very obvious. But when you work at a cancer center like I do, and you alluded to this, I think there's a lot of, there is this standard option out there, but we have a hunch or we have some preclinical evidence that this other drug might be better or might be less toxic. And if you will go along for that ride with us, that there may be some upside there. And I think if you have those shared goals of care early on and trust that the physician is, you know, not only has your best interest in mind, I think every physician has the patient's best interest in mind, but is following along your vision for how your treatment path is going to go, what your journey would be like. I think it makes it much easier to sell innovative therapies to those patients later on. Because sometimes these things on paper don't sound like great ideas, right? When you consented a patient for a study with tarlatamab or any other T cell engagers, you have to read them a sheet that says you could die from this, right? Or at the very least, you have a very high chance of getting very sick for a brief period of time. And if a patient reads that and they're not in a relationship with their physician where they are comfortable in knowing that their patient is not being too aggressive or has goals that are not shared with them, they're going to say no to that, right? They're going to read that informed consent document and say, why would I put myself at this risk when you're telling me there's another chemotherapy that I could just get off the shelf? And so having those conversations early on, perhaps even before clinical trials come into the picture, I think is so critical.
So I'll be brave if you're brave. I'll be brave, but only